Hi, I'm Natalie from ATMS and welcome to Natural Medicine Week. Today is day 3, which is very exciting. We're well into Natural Medicine Week and today we're going to be speaking about burnout. So if you experienced burnout before, or maybe have you recognized signs before it's too late. And I'm joined today by Dr. Adrian Lopresti. Adrian is a registered and experienced clinical psychologist and is an FX Medicine ambassador. Adrian is a distinguished researcher specializing in mental and cognitive health and well-being, and has extensive knowledge in natural treatments to enhance mental and physical well-being. Thank you for joining me today, Adrian.
No problem, Natalie. Thanks for having me.
Welcome to Natural Medicine Week. It's all very exciting this week.
Yeah, it's lots of great stuff.
There is. Now, for someone, I guess, who might be concerned or worried when it comes to stress and burnout, I guess, what's the major concern with stress and burnout, and how do we get so far down sometimes that rabbit hole?
Yeah, I suppose the thing with stress and burnout is that many people can have stress and kind of chronic stress or acute stress and not necessarily have burnout. So there are many people experiencing stress but don't have burnout. But when it comes to the other way, people who have burnout, it's typically associated with obviously ongoing stress, chronic stress. And often when you talk about burnout is typically associated with occupational stress. So that's generally what it's kind of viewed about. So there's ongoing occupational stress that then might trigger symptoms of burnout, and that would be kind of low energy and fatigue and a decreased kind of desire or motivation at work and things like that would typically occur with burnout. But there's also another condition which I probably like a little bit better, which is kind of called I'm not big on labels, but there's a term called exhaustion disorder, which is a bit more encompassing in that it includes not only stress from occupational stress, but you can also feel exhaustion associated with relational stresses that have occurred or caring for another or a loved one or things like that typically result in exhaustion and tiredness and so forth. And typically the stress is ongoing. It's something that happens for often months and sometimes years for many people.
And do you find you see this exhaustion because a lot of people aren't focusing on themselves, they're focusing on everything else in their life?
Yeah, it's typically an ongoing process whereby people are probably spending more time caring for others or too busy doing things that keeping busy and not looking after themselves, and their self-care is not typically so great. And that's fine for a short period, but over a longer period, what will typically happen is that burnout may typically occur for such individuals, and often they're not eating well and not sleeping well, and they're not engaging in activities that are soothing and they're just typically on the go all the time. And then once you've got that burnout, it's very hard to then engage in that self-care because you're so tired and run down. That will often occur. And sometimes what typically happens is many people with burnout will also then suffer from an anxiety disorder or depression or something like that is typically what people will experience. And then when you've got depression and anxiety, if you have depression, you typically have a negative view of yourself and the environment and the future. And so then that will then skew your view of the world too. So then that will then contribute to even more stress and burnout symptoms.
So someone's maybe thinking they could be going down this path. What type of validated tools can be utilized to help indicate burnout and stress and exhaustion?
You could use questionnaires. So there's questionnaires out there that people can use to assess burnouts. So there's the Sydney burnout scale, there's a Copenhagen burnout scale. There's a whole range of different burnout scales. Some of those are specifically associated with occupational related stress and caregiver type stress. So you've got those questionnaires that you can do, and some of those have ranges, and when you score within a certain range, then you have symptoms of burnout. So that's one option. And you could also then utilize different questionnaires, not only just burnout, you could also then utilize questionnaires associated with sleep. So there's a Pittsburgh sleep scale, there's The PROMIS, I like the PROMIS sleep disturbance scale that you could use. There's the Athens insomnia scale. And then from a mood perspective, you could also use questionnaires like the depression anxiety scale or the patient health questionnaire, which is, there's a short 4-item questionnaire that's there that you could use to assess symptoms of anxiety and depression. So you could use those questionnaires, but typically, it's really the questioning. It's am I tired? Physically or mentally, asking those questions, and yes, no, is this tiredness affecting my work, my relationships, my ability to complete everyday tasks? If the answer to that is yes, then do I feel stressed? And stress kind of being symptoms of heart palpitations and sweating and muscle tension and headaches and digestive symptoms. If you're ticking those, then you probably suffer from stress. And then also, what stresses are, ultimately it's because the questionnaires ask about symptoms, but they don't necessarily ask about causes. So then what stresses am I experiencing that might be contributing to my symptoms? So is there work-related factors that might be contributing to my stress? Is there relationship issues that are going on? Are there health-related issues that are going on that might be contributing to my stress? And so yeah, the questionnaires are great, but I think you can also just simply ask yourself questions and then indicating yes or no. And then if you are, then really, it's ultimately about trying to do things to help overcome those stresses and learn to manage and hopefully reduce the symptoms that you're experiencing.
And then, of course, if they find that they might be going down this path, to obviously seek a professional, healthcare professional, natural medicine, healthcare practitioner to really support them. But, what else in general, how can people maintain a healthy mental well-being? Maybe if you want to give, some top tips or anything like that, or any resources that you want to share with us today.
Yeah, I think it's always difficult giving kind of simple answers to that. So ultimately, though, I think the key is I'm always big on trying to identify causes. So ultimately, there's no magic bullet that everybody can utilize. And the question is, what are the causes or contributors to my symptoms? What's going on for me as an individual? And so two people experiencing burnout, the intervention might be very, very different. They've got potentially the same diagnosis, burnout or depression or anxiety, whatever diagnosis we come up with, but the causes may be very, very different, and therefore the intervention should be different. It should be really individualized. And so really, as I said, so identify the causes. And obviously, as I've mentioned, it's, are there stresses that are going on in a person's life, and how can they manage those stresses or minimize or avoid those stresses? And there's some great tools that people can utilize through either, obviously, if it's serious and significant, then seeking support from a health practitioner. But there's lots of good apps out there that can teach things like cognitive behavior therapy and helping you to change your view about the events and your situations, to trying to use positive or realistic self-talk to help overcome those. Obviously, there's lots of great meditation apps and relaxation apps that people can utilize from that perspective. There's even apps to help people with their sleep practices and sleep routines and trying to incorporate strategies there. And ultimately, and obviously, there's also some, several great supplements that people can take to help manage stress. And there's great adaptogens like ashwagandha and rhodiola, and for mood, kind of saffron and magnesium. And then you've got, if there's inflammation going on and your diet's not so great, then obviously multivitamins and B vitamins and omega-3 fatty acids. So you've got, obviously, I know I'm talking to the converted here with regards to a lot of those nutrients, but certainly they can really help support change and help kind of normalize some of the physiological changes that result from burnout, the excess cortisol that's occurring, the excess inflammation that's occurring, the neurotransmitter disturbances that often occur as a result of chronic stress too. So those supplements can also be really beneficial.
That is so good. Thank you so much for sharing all that today. And as you said, there is so much available for people out there who are experiencing burnout. And I like to also send people to the FX Medicine podcast, because I do know there's so much great information and resources shared on there. And thank you again for joining me for Natural Medicine Week, Adrian.
That's no problems. Thank you very much for having me.